давайте я сразу, наверное...
Dear colleagues, let me proceed with the presentation, and as far as I understand, you are delayed. My name is Sergei Dmitriev, and I am the director of Health Advocacy Coalition, and we work in Eastern Europe and Central Asia. And we do a lot of projects to ensure that CLM is adopted in different countries. I've also communicated with Eastern Asia about that, but I definitely will not be able to tell you about all the achievements of the region in 8 minutes. So I want to present the purpose of what we call community-led monitoring, why this is a promising area of activity, because this is about interaction between community of patients and the medical services in the context of the cascade of services. So CLM and the theory of change, how do we see the change and improvement of this instrument in the context of communities? Here we see some sort of switch from separate pilot projects to an integrated system of community control in packages of services related to HIV and TB. We mean here prevention services, access to testing, access to hospital treatment, access to treatment itself, and the most important thing for our community is presence of barriers, of violations of rights of particular groups of people, and the way these have an impact on prevention and testing and treatment. So the goal is to ensure the mechanism of control, accountability, and provision of services in HIV and TB context. And one of the pillars of the modern medical systems is this. And CLM could become a guarantee for the sustainability of the medical system in the context of our nosology. And it may be sustainable in the context of external challenges. Several interrelated models can ensure accountability of the medical system in front of the community and of the patients. And you can see here the sequence of our diagram. That's the way we see the transformation, the path. And well, we have fragmentation and integration, and CLM turns separate, fragmented pilot projects into a unified system, and it allows us to bring together all the services. It allows you to keep under control medical care providers, ensuring compliance with the existing standards based on a routine. So we use structured questionnaires, simple yes or no questions, and CLM allows to assess the quality of services, and it provides critically important information about the functioning of the healthcare system. And full information integration of CLM in service provision that would ensure permanent strategic assessment. We do not need to spend a lot of money on a specific instrument in the context of CLM. We believe it is easier to have it integrated in the existing service provision system. And transformation of the service provision in relation to HIV. This is something that includes country and other levels, and all these are covered by CLM. And the accessibility in terms of price will be a very good thing. The cost of the service will go down, and that will allow to add opportunities, particularly for marginalized and vulnerable groups. They will have a possibility to ensure availability and inclusiveness of services. And this is important in the context of raising capacity of a particular community. And CLM also increases accountability and equity. And the next slide is the transformation of service provision and partnerships. It's all about consolidating the partnership between the state, civil society, and community in improving measures to respond to. On slide 5, then. I think you should be able to share the presentation. Everything is clear. Thank you, Andrei. CLM has a critical importance in ensuring accessibility of care and in providing equality for all. And the focus is on feedback. CLM requires constant support. It will be better and more efficient. And the last slide, the 6th one, expanding CLM in all levels. Implementation of CLM on all levels and providing the option. One of the slides is the doubling. I said that already. So this is the key thing that I wanted to tell you about CLM. Generally speaking, we believe that this is the instrument that could determine the barriers in the cascade of services, which does not allow us to get 95, 95, 95, and 10, 10, 10. And this is also a very strong instrument in building capacity of the non-governmental sector, particularly in building capacity of the civil society. And it's, of course, a guarantee for involvement of medical services and interaction with the line ministries, like Ministry of Social Welfare and Ministry of Health. I will be glad to take any questions if there are any.